All right, good morning, class. This week we're going to get into testing. So, kind of like I said a couple weeks ago, this is a topic that I teach an entire class about at the University of Louisville. So, it's a topic that I'm pretty well familiar with. So, what we have today is two chapters. The first one is going to talk more about sort of the things you need to think about before you start selecting tests. And then the second chapter is going to go through kind of a bunch of tests that I'm not going to go through individually, but more sort of talk about what the general components of fitness are that you want to assess, and then maybe point out a couple quick tests that you could use to assess each component of fitness. Okay. So first of all, what are the reasons for testing? There are a couple big ones, right? Whenever you have a new athlete in, you don't really know much about that person, right? So you would want to test them in certain areas to see where their strengths lie and then where their weaknesses lie as well, right? What does their strength look like? How does their strength rank compared to a group of their peers, right? So whenever you do an assessment, you'll rank them according to age group, gender, maybe sport, even position, and see where they rank, right? And if they rank poorly against a group of their peers, then you need to work to improve their strength level or whatever variable that you measured there. Okay. So it's going to identify physical abilities that need improvement. You might, on the other hand, find that somebody scores really well in a different category, and you may not have to emphasize that with your training program, right? If you find an area of weakness that is important for success in that sport, then you know that you need to really prioritize that fitness component with your training program to get that athlete up to the level where they rank well against a group of their peers, okay? That kind of dovetails into the second reason, which is to set goals, right? They might have a goal of improving their strength by X number of pounds, etc. That's also a good way, you can use that for motivation, which is also an important factor to consider as well. And then another final thing is you're not going to just test somebody one time, right? You're going to do that initial assessment, and then you should reassess them periodically. Maybe, there's not a definite time interval, but maybe every 6 to 8 weeks is a pretty common time interval. And you use that reassessment to evaluate the person's progress, right? If you reassess them and their strength or their vertical jump has not improved much, then maybe the training program that you're using is not working. So you might reevaluate your training program, right? So the evaluation of progress not only allows you to evaluate the athlete and how they're improving, but it also allows you to evaluate what you're doing in terms of being the strength and conditioning coach. If your athlete is progressing well, then what you're doing is working. If they're not progressing, then what you're doing is not working. So you might want to change what you're doing. Okay, so there's sort of a two-fold reason there. Okay, so let's just throw out some terms. I'm going to point out a couple key ones. So a test in this case would refer to any procedure of assessment. So we can do a vertical jump test, the strength test, VO2 max test. There are many types of tests, and what we're really referring to is the assessment of some particular fitness component. A specific type of test is known as a field test. So a field test is something that is done outside of a laboratory, or a test that does not require expensive equipment, right? So often field tests could be things that you could do like in parks or in a gymnasium. Usually in that case, the only thing you would have to measure is, a time to complete a task, or you measure a heart rate response to something that the person has done. It doesn't require specialized measurement equipment. So field tests are very commonly done, especially like with youth sports or high schools, where they're not going to have access to laboratory-based equipment. Okay, you might contrast like lab testing and field testing. Those are sort of opposites. Lab testing is done in a lab, requires specialized equipment that is expensive. Field testing is done outside of a lab, does not require specialized equipment. Usually tests are going to contain measurements, so we don't need to define that. Evaluation is, the analysis of test results. I kind of referred to this earlier. Once you assess an athlete, you want to evaluate their performance, and you often do that by looking at how they compare against a group of their peers in that given test. Okay. Mid-test would refer to like the reassessment that I mentioned earlier. Post-test would be more referring to maybe if they complete a training program, you do a post-test. Or if you're doing a research study and you're applying a treatment or an experiment to a population, you do a pre-test before the experiment, and then you do a post-test after the experiment to see what the changes were that the experiment promoted. So what we're going to focus on now for the next few minutes is things you want to consider like when you're selecting a test. Now there are a lot of words on these next few slides. I'm gonna just pick out some of the key highlights of them, okay? With regards to testing in general, you want to make sure that a test is valid, that it has a high degree of validity, okay? And basically what that means is, does the test that you are selecting actually measure what it's supposed to measure? Okay. Now, any of the tests that are mentioned in the next PowerPoint, they are valid. Validity is achieved by doing research on a test. So let's say that we came up with a new test to assess vertical jump. What we would do is we would do a research study in a lab and make sure that our test that we just made up actually is effective at measuring vertical jump. And if it is, then we would have achieved validity for that given test, okay? Because the last thing you want to do is do a test that doesn't really measure what you're trying to measure, right? For example, a sprint test is not a valid measurement of vertical jump because you're not actually measuring vertical jump. Now that's a very simplified example, but it kind of drives the point across, okay? So a key phrase you would look for if you were like reading some literature is it would say this test has been validated to assess vertical jump or muscular strength, etc. And again, any test that you're going to see in our textbook or in the PowerPoint that we're going to look at next has been validated. I'm not going to go into these different types of validity because I just don't think it's necessary. Just again, have an overall understanding of what the term validity means, and that is best defined in this first bullet point right here. A second quality of testing that is important is reliability, okay? The best definition of that is that the test will repeatedly measure the variable correctly, okay? So is the test consistent? Is it repeatable? If those two things are accomplished, then the test is very reliable, okay? Now there are a few different things that can affect reliability. And we see several of those listed here. And then actually probably the first one is, actually they're all important. Let's go through all of them. So first of all, you want to make sure you control like the subjects or the athletes that you're measuring in terms of their skill level, right? A given test might be reliable for an experienced athlete, but not for a novice athlete. A good example of that is like a VO2 max test, okay? And if you all had my other class last semester, you saw a video where we have people exercise on a treadmill at their maximal level of exertion. Now, for an experienced runner or athlete, that's going to be a very reliable test for that person. But if I have a person who's not an experienced runner or they're a sedentary individual, a running-based test is not going to be reliable for that person, okay? Because they're just not, they don't have skill level appropriate for that test. So one way to enhance reliability is when you're selecting tests for different athletes is make sure that the test you're selecting is appropriate for that given athlete, right? There's a test you might use with college athletes that you would not necessarily use with youth athletes. That's a good example as well. Another way to enhance reliability is to make sure the administrator, which will be you, performs the test the same way every time. Okay, so that kind of goes down to this bullet point here: inter-rater variability. You want to reduce that. Okay, you accomplish that by just practicing. Make sure that when you conduct a test, you do the test the same way every single time, using the same procedures. Okay, and that everybody doing the test also does it the same way, right? Some tests, like I might do it different from you, so therefore the results will be different. The goal is everybody administering the test does it the same way, okay? And another way to control for that is maybe you just have one person do the testing. That way you know the reliability is going to be better, okay? Another possible example of this would be, you do testing at the same time of the day, pre and post test. So rather than testing an athlete once in the morning and then next time you test them, you do it at night, you test them in the morning both times, or you test them at nighttime both times. You make sure that if they drink coffee the first time, they drink coffee the second time, right? You want to make the conditions as consistent as possible. That would enhance reliability, okay? Those terms here on this slide, I sort of went through them on the last slide, so just take a minute to read those. But the consistency I hit on, the administrator or the rater, that's the same term. So make sure that if two people are doing the testing, that they're doing it the same way, okay? Now, another factor that we want to consider, and this is getting into more the selection of tests, is specificity, okay? Typically, a test can only measure one thing, okay? And you want to make sure that the thing you want to measure is actually measured by the test that you select, okay? Tests are very specific for muscular strength or muscular endurance. You can't measure both at the same time. Likewise, typically a test only effectively can assess one single energy system, right? So either the phosphagen system or the glycolytic or the oxidative. Now, when you're selecting a test, you want to consider what the needs of the athlete are. If you have an aerobic athlete, then you want to select a test that measures the oxidative system. But for that athlete, you really don't have an aerobic athlete. There's no reason to measure the phosphagen system, right? So you want to think about test selection. One thing you want to think about is in terms of the energy systems that the athlete is using. Select tests that effectively assess those specific energy systems, okay? Likewise, think about the movement patterns. Later, we'll see that, you can assess agility or sprint speed or both, okay? But in certain athletes, you may not need to assess agility because it's not required in that sport. So think about somebody who runs like the 400 meter, okay? They're only moving in forward sprint motion. They're not moving laterally, okay? So therefore, there's no reason to do a test that assesses lateral movement with a sprinter, right? So an agility test is not going to really be required for a sprinter. Now, on the other hand, if you had a basketball player, they do move laterally quite a bit, so you would test agility and sprint speed, right? So when we see in a little bit this long list of things that we can assess, just know that you don't have to assess all of those things, right? You only pick out and select and test the things that are required for that given athlete, okay? So that goes to the movement pattern of specificity. That's what that refers to. We've sort of already talked about experience and training status, but again, some tests are going to be more simple, and they would be more appropriate for less experienced or people with a lower training status. On the other hand, some tests are more intense. They require more skill. So you would want to save those tests for more experienced or people at a higher level of training status. So you always want to consider the individual person or the group, the team that you're assessing, and make decision with test selections based upon how experienced they are and then what their training status is as well, okay? Age, I would think, kind of actually folds into this pretty well. Usually, younger people, they may be less experienced in some cases. Not always, but, you can factor in age. As far as gender goes, there's really not too many considerations that you would want to make that might lead you to select one test for males and one test for females. You can typically do the same test with both. So sex or gender is not typically a factor when you're doing test selection. Now, we do want to consider the environment. Typically, you want to reduce the impact that the environment has on the testing, right? So you do that by having a controlled environment. A controlled environment is obviously better established indoors. Okay, so if you have the ability to be in maybe like a large gymnasium where the weather is not going to be a factor, right? If it's too cold or too hot, that can have a negative impact on exercise performance, especially the high temperature and humidity. That's going to increase sweating. That's going to affect cardiovascular response. That's going to make the activity more difficult to do. So that could have a negative impact on your test results. So the term that we like to use is a thermoneutral environment, which means an environment where the temperature is not going to affect the subject. Okay, that's one consideration. If it's a nice day outside and it's not too hot, not too humid, you could definitely do testing outside if you wanted to. Altitude, that can affect performance. That's not going to really be an issue where we live, either me or you all, because you all are in Ohio. I'm in Kentucky. We're basically at sea level, so it's not typically an issue. But if you are at altitude, that can make aerobic exercise much more difficult because there's just a lower concentration of oxygen at altitude, so that's going to make the exercise more difficult. Another thing to consider, which is not listed here, and it's not on the next slide either, is distractions. Some testing will require pretty good focus by a subject, so you might want to have a private environment. On the other hand, you may want it to be a very motivating environment, right? So if you're testing a group of athletes, if the rest of the team that is not being tested at that time is cheering for the person who is being tested, they will probably get a better result. Okay, so there's no doubt about it, right? If people are cheering for you, you're going to put forth a better effort. So there might be situations where you want to have that kind of loud, charged up environment because that could lead to better test results. Okay. As far as health and safety considerations, you should, have people fill out some paperwork to make sure that they don't have any health conditions that could negatively affect performance. You want to know about any medications they might be on. You want to make sure that they don't have any signs or symptoms of cardiovascular disease. Now, this is not something really that I've covered with you all in any of my classes, but I do cover this at the University of Louisville, where prior to even doing testing, you want to make sure that you screen people to make sure that they don't have to go get medical consent first. Okay, if an athlete has a sign or symptom of disease, or they have an unstable condition or an active injury, it's often recommended they go get physician consent prior to doing any testing. Okay, so consider that. Right now, if the athlete is healthy, no existing conditions, or they've been cleared by their physician, then you could proceed with testing at that point. Okay, but when you are testing, you do want to be observant of how the athlete looks. If they go pale suddenly, or they stop sweating for some reason, you would want to terminate the test. Have them lay down, elevate their feet, possibly get a cold towel to put on their head if it's hot outside. But just be observant of how people are, sort of the visible manifestation of how they're feeling. Watch that, and if something looks concerning, don't be afraid to just stop the test and have the person rest. Okay, and then maybe have them go see their doctor if they were feeling bad during the test. Okay, so can we finish this one up now? We've already talked about this. Make sure that you're you should know how to do a test. You should do the test yourself. Have it done on you before you do it on somebody else, so you'll know how it feels, because then you'll be better able to communicate it to somebody and teach somebody how to do it. Practice, right? You're going to increase reliability by practicing doing the test, okay? That will ensure consistency, which is good. Make sure before you start the test that you have the proper recording forms, right? So if you have, like in my lab, we have data sheets for each test that we do. The lab that you all took with me, if you did, you saw a similar thing, like the lab assignments I had you do. Those are basically data collection sheets. So often when we're doing testing in the lab, we'll just fill out the information there while the subject is doing the test, which is pretty handy. And a better option if you're testing a group of people or athletes is you have like one data sheet that has like room to record 4 or 5 different tests on it. I see that my camera is freezing up at times, so hopefully that's not messing with the video. If I see that happen, I'll kind of repeat what I said again. All right, the test formats, you can consider testing athletes individually or testing athletes as a group. Now, the test that you select is going to maybe influence that a little bit, plus how much time you have, right? If you're typically strength and conditioning coaches at the collegiate level, they're slammed with work. So for them, testing a bunch of people at once is going to be advantageous because it'll save time. All right. So also, there are some tests you can do as a group, and then some you'll have to do individually. So that's just kind of the way it is. Also, the amount of staff that you have available to you can determine how many people you can test at one time. Okay. Something like the 1 rep max bench press, where you need to spot somebody and be there to make sure the test is done safely. You're going to want to have a 1-to-1 ratio of tester to administrator. You're not going to have one administrator testing 3 or 4 people doing the 1 rep max bench press at a time, because that's not safe, right? So consider that as well. Okay. Typically, most tests may allow for multiple trials. So you'll allow, like on the vertical jump, you'll allow for 3 attempts. You'll take the best one as their score. Okay. Now, the last term I want to throw out here is a testing battery. So what that refers to is a group of tests, right? Most of the time, you're not going to just assess an athlete with one test, but you'll have 5 or 6 tests that you're going to do, maybe in one day. And that's what's referred to as a fitness testing battery, okay? So there's a certain way you want to arrange tests that we'll see here in just a second. If you're doing a testing battery, you want to make sure that you're allowing appropriate rests between tests, right? So anywhere from 2 to 5 minutes is recommended, depending upon what the test is that you're doing, okay? And you can often just kind of ask the athlete if they're ready to go on to the next test. And we'll talk more about that here in just a moment. The conditions we've already talked about a little bit. The humidity, the surface. If you're doing like a lot of jumping or high impact stuff, you're going to be better off having a softer surface. Really just not on pavement. Like even like a gym floor would be good. But turf, that could be a good thing. Rubberized flooring like in a gym, that's going to be a good surface to use. Make sure that you're using consistent equipment within a given test. So you're not testing one person with the barbell and one person with dumbbells. Make sure you're all doing all dumbbells, all barbells. Of course, proper hydration. As far as nutrition goes, I usually recommend that whatever somebody would consume like as a pre-workout, they should do the same thing pre-testing, because testing is sort of like a workout, right? We want to make sure that you have the energy to give a good full effort. So whatever you do as your pre-workout, do the same thing pre-testing. Don't eat like a giant meal before you do fitness testing, because that would not have you feeling good. But, like an energy bar, a banana, something along those lines would be a good thing to tell an athlete to consume before testing. And then lastly, there may be some form of warm-up that you would do for a given test. That should also be standardized, right? So, for example, when we do VO2 max testing in my lab, we have everybody warm up for 3 minutes. 1 minute walking, 1 minute of a slow jog, and then 1 minute at the running pace they want to do for the test. That's our standard warm-up that we do for everyone. So that's an example of making sure everyone is doing the same thing prior to the testing, because again, that will just enhance the reliability of the testing. As far as the testing administration, here's our last slide. You want to have a set date. Make sure the athlete is well aware of what day and time they're supposed to do testing, so they are well rested and on time for the testing. You also want to make sure they don't do a very intense workout like right before the test. Like some people come into my lab and they'll have worked out right before they do testing. Well, that's going to make a negative impact on the test. That makes no sense, right? I would say at least 24 hours you want to avoid hard exertion before a fitness testing battery is conducted. So you want to make sure the athletes are aware of that. You may want to have a practice session. So if there's tests that you're going to use that are unfamiliar to your athletes, they might come in like on one day and practice the test, and then they come in a couple of days later and actually do the test. That's something you could do for, it's called a familiarization protocol. Make sure you provide the instructions before they do the test. You might demonstrate the proper test performance either yourself, or if you have an assistant you're working with, you can have that person demonstrate it while you sort of talk through it so the athlete can visualize what they're going to do. That's important, especially if they've never done the test before. Okay. Warm up, we already talked about. Usually what I'll do is after the testing battery is over, I'll have the athlete go and change or whatever. And then while they're doing that, I'll tabulate their results. I'll compare their results to the norms that exist for that given test. And then I will communicate that to the athlete. And that's actually done. Like, we should flip these 2 bullet points. You want to do a cool down right after the test, and you supervise it. And you might measure heart rate and blood pressure after their cool down to make sure their cardiovascular system is readjusting the way you want it to. Okay. And then they go change and you prepare the paperwork and present it to them. All right. So I'm going to switch to the other PowerPoint, and this one will be, it's not going to take me as long to present it for sure. Let's close this one and open up this one. Although this one is longer, I'm not going to go through every slide because I think you all can look through it on your own. Okay. So now that you know all that, what are we going to do next? What you're going to do then is select tests that will fit with the athlete's needs that you're working with. Okay. So what you see on this slide is the NSCA recommended sequence of tests. Okay. The way that they set this up is so that the things that are not going to make the athlete tired are done early, making sure that you leave energy to do the tests that are more strenuous later. Okay. And then ultimately culminating in the tests that are going to be the most fatiguing are done last. Okay. Anaerobic capacity tests are going to be the things that are going to make the athlete the most tired and maybe make them feel the worst. So you don't want to have them doing more testing after those things. So it's recommended that those are done last. Okay. Where on the flip side, these things are basically resting tests. So they're not going to have a negative impact on anything done after them. Even anaerobic power, the most common test to assess that is vertical jump. Even though that is a maximal effort test, it only takes 1 second. So there's not going to be any residual fatigue that's going to last. Okay. So after the non-fatiguing test, it's recommended that you do agility next, if necessary. Now, again, with a sprinter, you may not have to do agility at all, and you would just leave that out. But with a basketball player, soccer player, agility is important for their sports, so you would do an agility test. Now, agility testing, even though it is done at a very high tempo, the tests are often very short in duration. So again, they're not going to leave the athlete feeling very tired afterwards, therefore having a negative impact on the rest of the testing. Okay. Now, once we get into these next couple, now we're looking at some fatigue might start to set in. Power and strength are going to be the most affected by fatigue. Therefore, it's recommended they're done next before anything else fatiguing has been done. making sure the athlete can give a good full effort. Most sports, the component of fitness that is the most correlated with success is muscular power and strength. Therefore, the NSCA sort of prioritizes doing this one here before any other residual fatigue starts to accumulate. Okay. From there, they then go to sprint testing. So if you have an athlete where sprinting is important, which most sports, that's a factor. So you're going to probably want to do some form of sprint test. Then we would go to local muscular endurance, then anaerobic capacity, then aerobic capacity. Now, as I've said, you don't have to do all of these. If you have a football player, right, where that sport is a very sort of a short burst test, you may not have to do an aerobic capacity test at all. In fact, you probably don't need to, so you can leave that off. On the other hand, if you have a marathon runner, aerobic capacity is important, but agility, max power, strength are less important, so you may leave those out for a marathon runner. The key point is, and I have this here in bold, you do not have to do all of these. You select those which apply to the given athlete, right? In fact, there's too many to do here, right? You don't want to do all these. You want to eliminate the ones that you don't need for that given athlete, okay? Second factor or thing to mention on this slide is if you do have to do a bunch of them, you might have to divide the testing battery into 2 days, which is okay. If you do that, though, you want to make sure the 2 days are evenly balanced. You don't want to have like an easy day and a hard day. You want to have 2 moderate days. So, for example, if you do have to do both of these types of tests with your athlete, you might do this one on day 1 and this one on day 2. You would not want to do both of these on the same day because that would really be hard for the athlete to do. So you would split them up across days, okay? So in fact, if you do have a lot of testing to do, it's more advantageous to split it up, have them come in like on a Monday and a Wednesday. Instead of spending 2 hours at the lab, they're doing an hour across 2 days. That's more manageable for an athlete to do, okay? So I want you to refer back to this. For the critical thinking assignment, I'm going to ask you to create a small testing battery for an athlete of your choice, a sport of your choice. After you select your tests, I want you to put them in order according to this sequence right here, okay? This is sort of a mini sequence. Follow this sequence, go in this direction, and then from there, you're going to go down. Okay. All right. So what I go through here is basically like a quick definition of what each fitness category is measuring. Anthropometry is basically a measurement of like external dimensions of the body. So common anthropometric measurements are height and weight. You're always going to want to take those. Girth measurements is doing like waist and hip circumference. You may or may not take those. It just depends. Okay. So again, that's typically what's always done first. After that, resting cardiovascular is resting heart rate and blood pressure. I do not have that listed here, but typically that is always done just to make sure. Resting heart rate is always good to know because you might need that later. And then blood pressure you want to measure just to make sure that it's safe to do testing that day, right? There is a certain blood pressure number that if it's higher than that, you would not do testing with that athlete on that given day. So next we would go from, body composition. So you're going to want to choose some form of body composition test. Skin fold testing is a pretty common one that will measure percent body fat, right? Height and weight doesn't really tell you necessarily much with an athlete because they might be very muscular and their weight is very high, but that muscle, that body mass is all muscle, right? So you want to be able to differentiate between fat mass and fat-free mass. So selecting some form of body composition test is going to be a good idea based on what you have available to you, okay? A skin fold caliper is a pretty easy thing to obtain. It is a very accurate test as long as you're well trained on it. So that's a good option, okay? Then we go to flexibility, balance, and stability. I kind of group these all together here, and on the sequence, mobility and range of motion is how it is listed. So you're going to want to do some form of, like the sit and reach is the most basic test. That is not really that useful these days. The functional movement screen is actually something that is much more useful because it looks at the individual joints and how mobile and stable they are. And that is actually very useful for determining what level of exercise an athlete can do, right? If they have very poor mobility and stability, they're going to need very basic remedial exercises, where if they have good mobility and stability, they can do more advanced exercises more quickly. So that is a super valuable test that you can do. We're not going to talk about that in this class. If you have questions about the functional movement screen, just email me and I can, give you some information about that if you're interested. So from there, sorry, I don't have anaerobic power listed on the slides in the sequence, but you would do that next. So typically the most common test that you would do for anaerobic power is the vertical jump, which is discussed in later slides, okay? So we're gonna skip that for now, we'll come back to it. Then we would go to agility, which is defined here. Basically, the agility is the ability to change direction with speed. Again, some athletes may not require agility testing. If all they do is run around in a circle, in a straight line, then they don't need agility, but if they're doing a lot of lateral movement, they would, okay? Speed is typically something that is a component of every sport, right? So something like the 40-yard dash, the 50-yard dash, 100-meter dash, anything that is, choose the one that's the most sport specific, that is a valuable thing to assess. And basically you're going to measure how fast they cover that distance. That's going to be their score. Muscular strength is typically measured using the 1 rep maximum. So that's going to be like what's the maximum amount of weight somebody can lift in a given exercise. The bench press and the squat are the two most common, and there are norms that have been established for that, okay? This process is described later on down the road. I'm just kind of running through the different fitness components. Anaerobic power, now that one we did, so here it's talked about, but we're looking at, can you exert force with speed? Okay, so again, vertical jump is the most common one. Another test that's described later is how fast can you sprint up a staircase. Not quite as applicable as the vertical jump is to many sports, but it's a good test that you could use with some athletes. If you were testing firefighters, that would be a great test to use, right? And then we have anaerobic capacity. So how long can you sustain all-out effort? The most common anaerobic capacity test is known as the Wingate, which is a 30-second all-out cycling test. And it's looking for, again, what's your peak power output? How long can you sustain that power output? That can be a valuable test for many athletes who are anaerobic in nature, such as a sprinter. You might do an anaerobic capacity test with a sprinter, but you might do a running-based test versus a bike-based test just to make it sport-specific. Local muscular endurance, is not as important for most athletes, but those are easy tests to perform. Like the push-up test is the most common one. There's another one that's described later as well. And then lastly, aerobic capacity. So you can either do a sub-max aerobic test or a max aerobic test, depending upon equipment. If you're working in the field, you're going to have to do a sub-max test. If you are in a lab, you can do a max test. Now, most athletes probably are not going to really need an aerobic capacity test, especially if they're a short duration sport or like a short burst sport like, again, basketball and soccer. But with a soccer player, they're moving a lot, so VO2 max could be a useful measurement, right? So again, select the things that are required for an athlete. If you have questions about that, you can always just email me and ask me, and I'll be happy to point you in the right direction. So here's a sample testing battery. Now again, I included everything. You don't have to include all of these components. You could leave some out. But what I did is I listed, for your first thing you would do is the resting measurements. And again, we would do height and weight, heart rate, blood pressure. For body composition, we would do a skin fold. Also measure the waist and hip circumference girths. And then for our mobility, we're going to do the functional movement screen. And for anaerobic power, the vertical jump. Okay. For agility, here are a couple of examples, the pro agility test or the T-test, which are described later. For our maximum power and strength, we're going to do the 1 rep max squat and the 1 rep max power clean. So the squat would be a strength test, the power clean would be a power test. For our sprint test, we're going to go with the 40-meter sprint. Muscular endurance, we're going to go with the push-up and the plank. How many push-ups can you do? How long can you hold the plank? For our anaerobic capacity test, we're going to look at the 400-meter run or the 300-yard shuttle. Those are 2 tests that are more appropriate for runners versus the Wingate, which is more appropriate for a cyclist. And then lastly, for our VO2 max test, we're going to do the 12-minute run and a test that is known as the beep test, which really asks the athletes to kind of go, it's sort of like doing a suicide, back and forth from baseline to baseline. That's more appropriate for a basketball player than running in a straight line for 12 minutes, right? Because they don't do that in their sport. They go back and forth, change direction. So what I did here is I listed all the components and I gave you a sample test that you could use for each one. But as I mentioned, ideally you would not do all of these fitness components with a given athlete. You would eliminate the ones that are not needed for that sport and keep the ones that are needed, okay? In the critical thinking assignment, I think I asked you to select 4 to 5 tests. I can't remember what number I said specifically, but it's not 10. So you'll eliminate some of these potentially. Now the rest of the PowerPoint here, I'm not going to go through and say much about it. I'm going to scroll through it all just to show you all, but I would like for you to take some time and go through it on your own, especially if you're interested in this topic, because what the rest of the slides do is they show pictures and discuss the various tests in a little bit of detail. If you want more detail, go to the textbook for sure, because if you notice, this first slide talks about the 1 rep max bench press, and it tells you that the technique is described in chapter 15. So it's going to refer you to the textbook. Here's the bench press, here's the squat. It's not going to really give you much information, unfortunately. Same here with the power clean. So anaerobic power, now it's showing that you can do like a broad jump to test anaerobic power, and the process is described here. Or you can use the vertical jump. You can do a vertical jump with a few different methods. You can either just have them jump up and touch the wall with chalk, or you can use the Vertec, which is a device that makes vertical jump testing very easy. These cost about $500, so they're not super expensive. If you worked in like a high school weight room and you had a budget, get a Vertec because you could test athletes like very rapidly, and you're not putting chalk all over your wall, right? So there's a benefit there. Or if you had even more money, you could get a jump mat, which electronically measures vertical jump, where this is more of a kind of an analog. You have to count how many each of these little planks corresponds to like an inch, and you would count how many inches that they jumped, where this one automatically measures it for you. So here are some examples of another anaerobic power test. Sorry, this is the stair sprint test that I referred to earlier. So this is a test that is very well validated. And again, if you were testing firefighters, you might use this test versus a vertical jump because they are going to be climbing stairs pretty regularly. Here's the description of the 300-yard shuttle. So this is anaerobic capacity. Now contrast that this is power, short term. Capacity is sustaining that power output. So 2 different things we're measuring there. Muscular endurance, here's the push-up is described. Make sure that this is where the gender might come into play. The norms for males were established using the regular push-up, which is shown here, where the norms for females were established using the modified push-up. So even if a female, which I'm sure they could do regular push-ups, when you test them, use the modified version, because when you compare their score to the norms were established using the modified version of the push-up, okay? Another option for muscular endurance is the YMCA bench press. I think this is a pretty useful test because not everybody can do a push-up, right? If you have somebody who's like obese, they may not be able to move their body mass. So instead of doing a push-up test, you could use this YMCA bench press. And the process is described here. It's really easy to do. And I like this one a lot because it's easier. You know, push-ups are, people's form with push-ups is so bad sometimes. I would choose the YMCA bench press because it's not as form dependent as something like the push-up is. Plus, you can spot people with the YMCA bench press, so that makes it a good one to use in some situations. And then here we go through some aerobic capacity options. These are field-based tests. Here are some agility tests that are described. So that some of these you might recognize, like if you ever watched the NFL Combine, they do some of these. Here's the T test. So you basically sprint, side shuffle, side shuffle, side shuffle, back pedal. That's one way to do it. Or you might sprint the whole way. So you're going to turn, sprint, turn, sprint, turn, sprint, turn, sprint. So there's a few different ways you can do a T test. So you want to make sure the athlete is aware of what exactly they're doing because they might have done it a different way in the past. The hexagon test is a jumping. So you jump out, jump in, jump out, jump in, jump out, jump in. Go around in a circle a total of 18 times, and you basically time how long it takes the person to do that. That could be a test that could be applicable to basketball or volleyball, something like that, where being able to jump quickly is important. And jump in different directions. This test might be applicable to those sports. Pro agility is another one that's pretty commonly done in football. So again, you could do this where you're turning and sprinting the whole time, or where you're side shuffling. Again, just make sure you communicate it to the athlete what they're doing before they start, so they know in case they've done it a different way in the past. Here are some examples of flexibility tests. So the sit and reach is the most basic test. I don't find it to be super useful, but if you don't have any other option, you could do this one. Here's examples of body composition testing using the skin fold. So this caliper is the Lang skin fold caliper. This is a really good caliper. You can pick one up for about $300, which is kind of expensive. But if you're going to use it for 10 years, that's a drop in the bucket, right? So if you're going to get into like personal training in your career, you could buy one of these and you could use it for 20 years to measure body composition with your clients very easily, okay? There is a technique to it, which I'm not going to go into here, but you want to make sure you practice a lot so you do it consistently, because that's going to make your body comp measurements more reliable. There's 8 sites. I only show 4 of them here. Here are where you would do different girth measurements. So you want to make sure that the most important thing with girth measurements is that you measure in the same place on the same person every time. So there's really not standardized locations, but for example, when you're measuring somebody's waist, if you want to do it at the level of the belly button, that's okay. Just make sure you do it there every single time you measure that person. That's the most important thing with girth measurements. All right, I'm running out of breath here, and I think that finishes it up, actually. When you get scores after your testing battery, you're going to want to interpret them. So you could put them into statistical programs, possibly, or you might more commonly compare them to norms that have been established for different genders, age groups, etc., and you're going to give them a percentile rank, right? So if you say that you're in the 80th percentile, that would mean that they scored better than 80% of people who've done that test in the past. If they score in the 10th percentile, that means they were only scored better than 10% of the people who've done it. So that's how you would communicate percentile rank. You should be able to find norms for any test online or in textbooks. They're going to probably have charts that have been developed that show that kind of stuff. Most people are, this is your typical bell curve. Most people are going to exist here in the middle, which is why it's so high, with the outliers being, like elite athletes and then novices over here. Obviously, by doing testing, then you can sort of develop this athletic profile on your athlete and see where their strengths are, where their weaknesses are, and then through your training program, you're going to use the results of your test to inform how you're going to design a training program for somebody. That's an important thing, right? So if somebody's really weak in a category, you should emphasize that in your strength training program or your athletic training program to make sure that you pull up that weakness up to the level where it needs to be with a given within a given sport or group of athletes. Repeat testing, do the testing battery periodically to make sure that the athletes are improving. If they're not, you're going to need to do something different with your training program. Okay, so that was a lot of words. That went longer than I thought it would, which is okay. This is, like I said, I teach a whole class on this at University of Louisville. You have your study questions. Again, your critical thinking assignment is going to ask you to create a short testing battery. So I'm going to ask you to pick an athlete, pick a sport, whatever you want to do, and then select 5 components of fitness that need to be assessed for that athlete. List those, and then select a test that will assess each component. And you can go back, through these slides and look at the ones that were recommended, back here. Or you can use that slide where I gave you a sample testing battery and use those tests that I recommended. That's fine. The key with this assignment is I want you to get used to sort of narrowing down the components of fitness you would need to assess for a given sport and then picking an appropriate test for that fitness component. Okay? So that's it, everyone. Hope you're enjoying this class. We're going to get into program design next, which is a really important skill for you to learn. So we'll come back and talk about that later.